I get up 5 times a night also and cannot hold my urine. So this is great. So prostate issues are going to remain a problem for men. So by the time you're in your 90s, about 70% of men will have some prostate related symptoms or issues. So the prostate is kind of doing its own thing, and we don't really know how to slow down prostate growth. And the verdict is out in terms of what is fueling prostate growth. I tend to be of the group of providers that really feels like prostate enlargement is fueled by inflammation. It is fueled by endocrine disruptors and fake estrogens and testosterone disruptors that we are encountering on a daily basis, which are modulating and manipulating our hormones, and it's interfering with what's happening in the prostate. So with that being said, what are some of the things that we can do naturally to improve prostate symptoms and to slow down this hypertrophy or this growth of prostate cells? So I wanted to play for you the question that really made me feel like this was something we really needed to cover in depth today, because to me, it really feels like this gentleman is scared. And I want to acknowledge that it is a scary thing. Like we've had uncles and fathers and brothers pass away from prostate cancer. So anytime anyone says the word prostate, we automatically get a little bit of fearful, like we're like, is this cancer? Do we have to have a surgery? What is next? What is next? What is next? So I got 3 big questions about prostate, and all 3 of them sounded very much like, doctor, please help me. So first of all, I want to just calm things down a little bit and let you say, listen, slow down a little bit and let's talk about it. And then I want to play for you the question that just reminded me of what a scary process this can be. And what I want to do is take the fear out of it and just give you a very proactive approach to how to handle some of this, right?
Finding out what options can I consider in reference to the possibility of prostate. I'm having issues in regard to of urination. I'm also having challenges as far as just wanting the support of getting back to our old self. So whatever you could do is appreciate it. I'm looking for the options to surgery and what is radiation. That's it, radiation.
Yeah. So as you can tell, what interests me about Jeffrey's question here is that he's whispering. He's got a little bit of fear in his voice, and I think that that's valid. So let's kind of get into it. What I want to do with you is I want to share with you kind of the algorithm that doctors are using when you come in with prostate issues, so that you can kind of understand the thought process behind what it is that the average doctor is doing here. So this is kind of an enlarged prostate protocol, right? So you come in, with the consultation for prostate hypertrophy. BPH is what it's called, benign prostatic hypertrophy. And basically, you come in, maybe they'll do a digital rectal exam, where that's where we put a finger in and feel the prostate from within. Of course, they'll do a PSA. A PSA is a lab test for prostatic specific antigen, which actually can be elevated after a digital rectal exam, after sex, after a horseback ride, after you've been on your motorcycle. So many things can actually artificially elevate your PSA. And then what they'll do is like something called a post-void residual, where they're looking at, after you urinate, how much urine is still left in your bladder. Because when we're thinking about the prostate, remember, as the prostate grows and enlarges, there's actually going to be some level of obstruction sometimes. So when you're thinking about it like that little heart-shaped object, remember that's our prostate. As this starts to enlarge, what it can actually do is make it so that when you're making urine, your urine doesn't come all out like it's supposed to. It just kind of gets stagnant in the bladder. And so a post-void residual, or PVR, actually tells them, well, how much urine is still left in there after you pee? Because that gives us an idea of how bad things really are, right? So then after all of that, they say, okay, well, based off of your symptoms and all the tests that we've run, you have an enlarged prostate. So what we're going to do is put you on what's called an alpha blocker. So let me show you this here. A little edit. So that's where we are here in this process. So an alpha blocker is the doxazosin. I always call them the azosins. So if you look at the bottle of your of your prostate medication and it says doxazosin, tamsulosin, osins, those tend to be our alpha blockers. Now, what the alpha blockers are doing, and let me kind of show you a little bit more about what it is that they're actually doing. They are actually going to be working on tone. So this is not something that can potentially shrink your prostate, but what we're actually trying to do is decrease the symptoms associated with your prostate symptoms. So I got this great diagram here from the British Medical Journal. And what I like about it is that it really talks about at what level everything is happening. So right here is where we're seeing our alpha blockers take place, right? So what they're actually doing is they are blocking alpha receptors to kind of, loosen muscular tone, loosen the smooth muscular tone. So as the prostate actually starts to grow, what unfortunately can happen is that the prostate the muscle actually starts to get a little thick. The bladder outlet where the urine is supposed to come, the neck of it actually starts to get a little thick. And so what alpha blockers are supposed to actually do is they are supposed to actually block this process so that we can get a little relaxation in these muscles so that we can improve symptoms. So alpha blockers, the tamsulosin or the doxazosin or whatever your osin that they have you on is designed to kind of improve prostate-related symptoms. So they're supposed to work within the first 2 weeks of you being on them. If you've been on them for about 2 weeks, and you don't see any resolve, something else is going on there. Now, one thing about alpha blockers that you've got to be cognizant of is that they're not going to reduce the size. They are really just designed to help relax the muscles of the prostate, kind of some of the muscles of the bladder that need to relax in order for urine to flow through smoothly right there. So that's one thing I want you to really kind of keep in mind is that's what it's for. It's kind of for this dynamic component where we know that this has become so thick. The smooth muscle here, the bladder, neck, and the prostate have become so thick. Now we want to relax it so that you can have less urine, what we call urinary retention. The reason why urine can stay stuck up in there and then you have to pee so many times at night is because it's retaining. Your bladder is holding on to the urine instead of pushing it all out each time you urinate. So if you go back to some of the lifestyle videos I talked about, where I talked about prostate, one of the big things I said is that you want to sit and you want to push that last little bit of urine out when you do urinate so that you're not retaining it as much, right? Another thing with nocturia or urinating so much at night is that this bladder wall, so imagine it like this. If you have urine sitting in your bladder all day that's not getting fully emptied, think about if you've ever peed on yourself. Think back in the day where maybe you peed on yourself and you didn't want to tell your mom about it. By the end of the day, wasn't that stuff burning? I mean, it's like, it just feels so uncomfortable, right? So imagine if urine is just constantly sitting in your bladder that's supposed to kind of go through, but it never really fully gets emptied. So your bladder starts to get irritated. And because your prostate is enlarged, that bladder actually gets something called atony, which basically means it's just kind of like a floppy bladder or kind of weakened. So some of these symptoms are related to the prostate and the urethra, but also some of these symptoms are related to the bladder. So you'll notice some of you are on prostate medication where your doctor put you on overactive bladder medication too, because they've listened to your symptoms and they've looked at the lab results, the studies that you've been through, and they've decided, you know what, part of this process is because your bladder is overactive, right? So that's one set of medications. The next one that we're going to talk about is the 5-alpha reductase inhibitors. You know, 5-alpha reductase inhibitors are like finasteride. We also use it sometimes to help people who are going through male pattern baldness. The bad thing, okay, so the alpha blockers can give you hypotension. So You might notice you get up from a seated position, particularly if you're already on blood pressure medicines or something, you're dehydrated even, you get up from a seated position, you just get a little lightheaded. Well, that's the alpha blockers working on the alpha receptors, even in the vasculature. So you can actually become lightheaded. You can actually become dizzy. You can have orthostatic hypotension. And one of the things with alpha blockers long term that we have to think about is that if you ever go in to have cataract surgery, that being on alpha blockers for a really long time can actually increase your risk of having something called intraoperative floppy iris syndrome, which basically means it's a complication in cataract surgery, which makes it really difficult for them to complete the process. So there are some long-term side effects that can be associated with the alpha blockers. Now, when we're talking about our 5-alpha reductase inhibitors, the finasteride, now these, okay, you're not going to see any immediate impact with these. These take about 6 months to even notice any difference. But my problem with it is, okay, so these are designed to block DHT, dihydrotestosterone, right? And we talk about DHT because DHT is the ultimate form of testosterone. We need it, you can use it to build muscle. You can use it very energizing. It's like a hypertestosterone. So then when we block it out, what happens to follow? Sometimes we have a really low sex drive, to the point sometimes that when you come off of finasteride, it's really hard for us to help you with the sex drive issues. So that's one thing with finasteride, is that it really can cause erectile dysfunction and all types of things when it comes to sexual dysfunction. So that's one of the issues with it. So the two main medications that we have to treat prostate related issues, really, in my opinion, and some urologists are going to text me after this and be mad at me, but in my opinion, is designed to send you straight to their office so that you need a procedure, because they don't work all that well, unfortunately. Now, we'll talk about all the different procedures in another video, but I will say this: once you've had a procedure, and when they call it minimally invasive, you just going to come right in and we just going to do blah, 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 it's never quite that simple. Before surgery, before you let any urologist or anything touch your prostate or anything else, you want to ask, what's the risk? What's the benefit? You want them to be very well aware of your whole past history, your whole condition, all the medications, all the herbal supplements that you've been on. You want to know, well, exactly how big is my prostate? What is the shape of my prostate? You want to know about treatment failure. You want to ask, so well, what happens? How often is this failing? And what does failure look like, right? Talk about the side effects. If you're just going to put some warm steam that's just going to kind of burn off the prostate tissue, what are the side effects of that? Am I going to be able to ejaculate afterwards? Am I going to be able to have sex afterwards? Ask all of these things. And you also want to talk about retreatment options. So, doc, if this doesn't work, can you retreat? And if so, what does retreatment look like? Or if this doesn't work, what are my next options, right? Because even though we as physicians use the term minimally invasive, there's always risks associated. So you want to be very clear about those risks before you decide to do it. Okay, so we've talked about the alpha blockers. We've talked about the 5-alpha reductase enzymes. Now I want to talk about, let's talk about Cialis. How does Cialis play a role in here? Well, what Cialis is actually doing, and you'll use in Europe, they use it pretty much. It's pretty much standard of care. They're actually adding it as an adjunct, because what we know is that when someone is taking something like Cialis or a PDE5 inhibitor, that it's actually kind of reducing some of that, relaxing some of that smooth muscle tone, so that it can decrease some of the symptoms. So we're actually seeing an impact, not just on the bladder, not just on the prostate, but even in some small way in the urethra. So that's why we add that sometimes on there. And then this top one is kind of a newer way that we're doing is that we're adding on this overactive bladder medication. So technically, you can go in with the prostate issue and end up on 1, 2, 3, 4 different medications by the end of it, right? And your prostate might be feeling better, but let's even talk about what this is going to look like in terms of side effects Or if this is if this isn't you, if this isn't something you want to do, what are some of your other options, right? So taking you back to this kind of this algorithm that we use, because in healthcare, whether you realize it or not, we use algorithms. Algorithms is, like the insurance companies won't pay us if we don't follow the algorithms on certain things, believe it or not. So with this algorithm, we've gone through, you're on the alpha blockers, you give it about a month to try, and then you come back. They go over everything with you. And then if you're still having issues, they might do what's called a cystoscopy, which is basically taking a small camera, entering into the urethra, the head of your penis, and kind of going through and looking at the bladder and looking at the prostate to see if there's any obstructions or what they can see there, right? Then they're going to go over the results with you about that. And then they're going to give you some other options. We can either watch and wait, or we can do a procedure. So they'll talk about all the different minimally invasive procedures that they can do, or they might say, it's so enlarged, you need a major surgery. And then what they'll do during this period is continue the alpha blocker. They may put you on on some of the other medications that we talked about. And then eventually they're going to tell you, listen, you probably want to get a procedure done. So let's talk about some of the other things that you can actually do to kind of minimize some of these symptoms. Now, I did one of my most popular videos that I've ever done is where I talked about some of the other options other than medication for prostate health. And when we look at some of the other countries, like European countries in particular, they use a lot of phytotherapies or plant-based therapies before they decide to use many of the medications and before anyone goes to therapy, to any of the procedures. So one of the big things, saw palmetto, pumpkin seeds even. If you go back and look at some of these videos, you'll see that guys just like you have tried some of these things and are having amazing results. Another thing that we have to talk about is after your doctor signs off and says, yeah, well, you can try some herbal supplements. You can do that because, no harm, no foul. You're already getting up 5 times a night. Things are already bad. I mean, can any of this worsen things? Try some of the supplements that we're talking about here, but also consider prostate massage. When you think about a prostate massage, now that you know what we're dealing with, it starts to make sense, right? Because remember, when you're dealing with symptoms related to your prostate, you're not just dealing with the prostate here. Well, let me see, where's my finger? You're dealing with the bladder. So your bladder can be inflamed and causing some of the issue. The outlet between the bladder and the urethra can become obstructed just from the sheer size of the prostate. And then erectile dysfunction kicks up because remember, so many of the nerves to innervate the penile tissue for erection course through the prostate, beneath the prostate. Blood flow has to come through all of this. So the prostate health becomes so very, very, very important. So I always say to my guys, let's try some of the simple things. Once we've ruled out prostate cancer and we know that's not there, let's see what we can do with some of the simple things. Can we get away with doing herbal supplements? Do we need to try alpha blockers while you're taking some supplements so that the supplements have time to work? And then can you wean off of the alpha blockers? So there's always going to be some other options there. And when I say pumpkin seeds, sometimes people are like, pumpkin seeds? How the hell are pumpkin seeds going to work? Well, I want to remind you of that study that we talked about that had about 100 patients that had BPH. All their prostates were enlarged. The symptoms were relieved for just by using prostate symptom oil, pumpkin seed oil for like 24 weeks in about 47 of those men. So about half of them had improvement just from pumpkin seed oil. So I say this to say, we talk about all the time how food can make you sick, how sugar does this and this and this and that. Let's also talk about how some of these foods can heal. You can take pumpkin seeds and start sprinkling them on your salads. You can grind them up and put them into your smoothies. You can take a handful of them to work with you and snack on them. And guys are actually seeing impact, seeing change within a couple of weeks with that. So now, is everybody going to find benefit in pumpkin seeds? No. But look at the list, go back to the video, look at all the different things we talked about, and talk to your doctor about whether or not you should try some of them. And oftentimes they'll say, sure, why not? No harm, no foul. It's not going to work anyway. Well, then you can actually be a beacon of change for you, your community, and your doctor by saying, well, look, doctor, I tried some of these things and they actually worked. Now, remember with our prostate massage, so, we talked about the 3 different ways you can do it. You can do it suprapubically by targeting the bladder from the top. Oops, here I am. I'm backwards. By targeting the bladder from the top, you remember, you kind of go in from the top, because remember, part of the symptoms are related to the bladder, but the prostate sits right underneath the bladder. So massaging the bladder actually is inadvertently massaging the prostate. There's also prostate massage externally, where you're putting an external vibrating prostate massage externally so that you can actually, stimulate it from beneath. Then there's the way of prostate massage internally, where you're actually going in from the rectum and you're targeting the prostate from behind, right? Or you're doing all of them and having some impact. So if you happen to be interested in prostate massage, I do have a line of prostate massagers. It comes with a prostate massage book, because I think there's a lot of questions like, how long should you do the prostate massage? Everybody is so different, but your ideal when you're doing the external is that you want to work your way up to 20-minute sessions. Start out slow and low because you want to see if you're going to see some improvement. Think about a massage in terms of your shoulders and your neck. It takes a minute for you to see any impact, but oftentimes you do. Keep in mind that with the prostate, you have ductwork that goes through there. Your ejaculate has to travel through the prostate. Guys are coming back and saying, Doc, thank you, because now my ejaculate is back. It had gone. But a part of that too is the seminal vesicle sits right here behind the prostate. So if you're doing it internally, you're also stimulating that seminal vesicle, right? And then you, of course, get your manuals with it. And this one is our internal massager. It's got a nice loop here. And I think the thing about an internal prostate massage is it's scary because we just kind of think of this area, poop comes out of it, what else? But there is a technique that you use so that this does not have to be painful. It doesn't have to hurt. And then I just want to remind you how big poop is. Poop can be huge. If you are regular, you sat on the toilet, it was about this big yesterday. I mean, that's way bigger than a prostate massage. So what you want to do is you want to look at the different medications that we've talked about. Look at your doctor's plan for your prostate care and ask your doctors about some of these other options. Ask them about some of the herbal supplements. Ask them about saw palmetto. Ask them about zinc. Ask them about Pygeum africanum. Ask them about the pumpkin seed. Ask them about the beta-cytosterol and the pine bark. All of these different things are known clinically. There's plenty of clinical trials around each and every one of the things that I've mentioned, so that you don't necessarily have to rely on the medicinal route, but you do want to take a proactive route, and you want it to be supervised by your physician. If you don't trust your doctor, then it's time to get a new one. If your doctor isn't listening to you, it's time to get a new one. Listen, you have options. It's like a store. You don't have to go to this store. You can go to that one. The doctors are the same way. And then if you want to fire your doctor, you go to your insurance company and say, listen, that doctor you sent me to, we didn't get along. I didn't like them because of X, Y, and Z. And I would like for you to assign me another one. We need to start holding the insurance company, holding them to it. They owe it to you to provide you with health care that you can trust and that you think is great. Okay? So good. Good evening. My doc told me I need surgery. I have BPH, but it's not comforting news. Okay. So when you have BPH, needing surgery is a opinion, right? Because BPH means that you don't necessarily have prostate cancer. It means that your prostate is so enlarged that it's causing you a lot of symptoms. So one thing I would go back is ask him those list of things. How large is it, doc? What's the size of it? Are there any abnormalities? Are you worried about prostate cancer here? Do I have any other options than surgery? And then let's see what he says. And then you want to bring that back to your primary care doctor or to another, urologist and see if what their opinion is on it. Because when it's just BPH, remember B in BPH stands for benign prostatic hypertrophy. And benign means, it's not cancer. So what are our next options, right? So when someone tells you you need surgery, ask them, do I need surgery or are you recommending that I have surgery? Because those are two different things, right? Needing surgery means we need this or some major catastrophe is about to happen. And sometimes that is the case, but you want them to clarify and let us know how that's going.